Dr. Ashwini. I'm a senior consultant in the Department of Reproductive Medicine at NU Hospitals, Bangalore. Today I'll be discussing the topic of low ovarian reserve. Ovarian reserve corresponds to the pool of the eggs in the ovary at any given point of time. Low ovarian reserve means a physiological decrease in the number of eggs in the ovary. So this results in an insignificant number of eggs to result in a reasonable chance of pregnancy. So unlike men, women are usually born with a limited number of eggs. So it's maximum when the fetus is in the womb of the mother at about 6 months of pregnancy. At this stage, it is usually about 5 to 6 million eggs in the ovaries. So at birth, it decreases to about 1 to 2 million. By the time of puberty, it further comes down to about 2.5 to 3.5 lakhs. And by the age of 37 years, it decreases to 25,000 eggs. And at menopause, it further decreases to about 1,000 eggs. So this is how the physiological decline goes on. So the cause for decreased ovarian reserve is definitely physiological and age related. So this decrease starts at the age of 30 years, and after 35 there is an accelerated depletion of the ovarian reserve. But in some women it starts in an earlier age of 20s. So this is usually genetic, or in some cases it could be immunological related. But there are other reasons for decrease in the ovarian reserve as well. So many a times it could be the surgical procedures on the ovary, like endometriosis or any other cyst excision. And sometimes the decrease in the ovarian reserve could also be because of the chemotherapy and radiotherapy which the patients receive for cancer. So what are the tests for ovarian reserve? There are usually two tests for ovarian reserve. One is the blood test and the other one is the ultrasound. In ultrasound, what we look for is the antral follicular count. Antral follicular count is the small follicles which we see in ultrasound, measuring about 2 to 10 millimeters. So other than that, the blood test includes the AMH, which is very specific, and apart from that there are other tests like serum FSH and serum estradiol levels, which give us an indication about the ovarian reserve. So the options for a patient with low ovarian reserve are multiple. One is we have to individualize the treatment based on the age of the patient, duration of infertility or duration of married life, and the previous treatment history. If the patient is young and married for a short duration of a few months or a few years, and if the ovarian reserve is marginally decreased, they can still try simple treatment like IUI. But if they are old, married for a longer duration, or have been trying previously with multiple unsuccessful treatments, the best option is to go ahead with IVF ICSI. And till date, we have not been able to find a reasonably good treatment to increase the number of eggs. So what we have is a few adjuvants which can increase the number of eggs which grow in that particular cycle, and these can be used as an adjuvants in IVF treatment. And when it comes to the IVF treatment, as such, the various protocols which have been tried, but none of them have proven to be superior when compared to the other. So the overall success rate, even with IVF, depends on the number of eggs we get, the age of the female, and the quality of the embryos we get. Sometimes when the ovarian reserve is very low and we have not been able to get enough oocytes in IVF cycle, such patients can consider alternative treatments like use of donor eggs.